This procedure video will take you through the techniques of performing a bimanual and then a speculum examination. These examinations have occurred numerous times in the last few OSCE exams. The station will commonly ask you to attempt to remove a lost condom and then to counsel the woman on the possibilities of emergency contraception and post-exposure prophylaxis. As in all procedures, formal introduction, a thorough explanation of the procedure, and the obtaining of verbal consent is essential. Before watching the video, take a moment to familiarise yourself with the equipment shown above.
Okay, we're going to start today by going through a bimanual examination, and then we're going to move on to using a speculum as well. We're going to go on and show you how to do a bimanual examination. Again, introduce yourself to the patient, explain what you're going to need to do and why you need to do it. Make sure the patient is comfortable, and also ask for a chaperone. Expose the patient to make sure you have good lighting. Get the equipment that you need that's ready. Make sure you've washed your hands and that you're wearing sterile gloves. Start by inspecting the external genitalia, always talking to the patient and telling them what you're going to do. Then with your non-dominant hand, separate the labia majora, have a gentle inspection, then using 2 fingers, gently, while looking and talking to the patient, insert the fingers. Start by putting your hands behind the cervix, with your non-dominant hand on the lower abdominal wall. Push the cervix up gently so that you can palpate the uterus for any masses, and look at the patient to see if you're causing any tenderness. Then go up into the left adnexal, pushing your hand down so your hands are almost touching, again looking for tenderness or pain that you might be causing and feeling for any masses. And the same up in the right adnex. Then move your hands back gently, and with your hands either side of the cervix, gently move the cervix side to side. This is causing stretching of the fallopian tubes to see if there's any cervical excitation. Then gently move your hand a bit more and palpate the os to see if the os is open. Once you've finished, gently remove your fingers, explain to the patient you're finished, help clear them up, and then give them some privacy to get dressed. This is the equipment we're going to use, and then you prepare your area. So you get the patient in a comfortable position. You ask for a chaperone as well. We'll start with the speculum. All your equipment laid out so that you're ready. Explaining and talking to the patient as you go through, making sure they're comfortable and they understand why you're doing this. Okay. Start by washing your hands, putting on your gloves, making sure you have good lighting in the room. Get the patient supine on the bed with their legs bent, their ankles together and their knees out to the side. Start by inspecting the area. Explain to the patient you're just looking in the local area to see if you can see any obvious abnormalities to begin with. Warm the speculum up if you need to. Make sure it's closed. And then put some gel on it. Always talk to the patient. Explain to them you're going to start the procedure. Open up the lips with the non-dominant hand, and then gently, while looking at the patient and talking, insert the speculum gently, aiming for the posterior fornix. Turn the speculum round, again all the time looking at the patient and seeing how they are, and then gently open up the speculum. The cervix should appear. Have a look. You can look at the cervix, you can also look at the vaginal wall. If you need to, clean the area inside if there's too much blood. If you need to take samples, you can then proceed and take samples. You can do high vaginal swabs. Sometimes useful to have someone to help you so they can pass these to you. You can then also go on and do the endocervical swabs. When this is finished, again explain to the patient you've finished. Gently release with your hands, making sure you don't catch any of the vaginal wall. Turn it round and remove gently. Then offer to clean the patient up, giving them some privacy, and allow them to get dressed and explain that you've finished.